Welcome back to the Health Revival Show. Today we have McKenzie Redd. She is a doctor of physical therapy and specifically focuses on pelvic floor therapy. I actually met with her virtually after having Ethan, and I'm excited for her to share her expertise today because she has been in the practice of pelvic floor therapy for many years, but after 5 years transitioned into virtual care to support moms specifically in their postpartum recovery, prolapse healing, and freedom from leakage so that they can live life without limits. Because we know that this pelvic floor issue is pretty impactful if people are just leaking and having accidents all the time. So we've come at this topic from the menopause aspect and how pelvic floor is so important in those years, but we want to come at it today from a postpartum perspective and specifically C-section. So I'm excited to dive in. Welcome to the show, McKenzie. Thanks for being here. And first, just start off with sharing your story. How did you get into this?
Yes, thank you for having me. I'm so excited to talk about pelvic floor. I started in this route. If you are a physical therapist, you kind of graduate out of school into just a general, broad, you can go into anything, but you don't have a lot of specific knowledge in one particular area. And in school, I was exposed to pelvic floor therapy. I got to follow a clinician in her practice, and it really dawned on me then what a poor job we do with women and what an impact addressing their pelvic floor can make in their lifetime. And I knew I wanted to have kids. I always tell people it's a selfish reason because I knew I wanted to have kids, and I kind of saw this path that these women would go into it, which was have a child, experience dysfunction, and then down the road they were coming into pelvic floor PT just so lost and confused and frustrated with the system that kind of had thrown them in a hurricane before landing them where they actually got healing and support. And so I knew right then, I'm like, if I want to have an experience that isn't bad, if I want to be proactive about this, I'm going to have to dive in and learn and know what I want out of my birth experience, my postpartum experience, and kind of learn how to take care of myself. And through that, it's been so rewarding. That was my initial kind of dive in, but then the more I worked with women, the more it was like nobody had talked to them about these things. They had been to all these specialists. They had been around the block. They're so frustrated. They have so many questions. And it wasn't until they came to pelvic floor physical therapy that they finally got those answers. And that's such a rewarding experience to be able to solve decades of issues or, see a woman finally get to like have the life she wants um, because we were able to help her in a way that nobody else could have or anything else that she had tried. So it's so rewarding and I love that aspect of it. And I think women's health is just one of those subjects that is only going to become more popular as women start learning what resources are available and what they can do to heal themselves rather than just wait and see what happens.
Yeah. And sadly, it's just not brought up. I brought it up to my OBGYN postpartum, and she's like, absolutely, that would be a great idea. And here's recommendations for you. Because I was asking for a referral
Yes.
to somebody locally. And I'm like, well, if you have these tools and you strongly believe in this,
Hmm.
why didn't you recommend this? I think it should be covered by insurance, and I think it should be part of
Yes.
pregnancy and post
Yes.
care, to be honest.
Yeah.
Because I think also, all right, if you're dealing with water retention, you're waking up puffy, your ankles or your wrists are really swollen, or you can't get your rings off, and maybe you're even dragging throughout the day, no matter how much water you drink, there's actually a good chance that you're not actually hydrating properly.
Exactly, because water alone is not enough. You need electrolytes, you need sodium, potassium, magnesium, because those things actually pull water into your cells. Otherwise, you're basically just flushing it out and wondering why you're still tired, you're still bloated, and you're still sluggish.
But here's the thing, most electrolyte supplements out there aren't helping you in any way because a lot of them contain things like natural flavors, food dyes, and maltodextrin, which can irritate your gut. And these things can also spike your blood sugar when you're trying to heal.
That's why we both started using Buoy. It's super simple, just trace minerals and electrolytes in liquid form. No flavors, no colors, no sugar, no sweeteners, and you squeeze it into whatever you are drinking. Water, coffee, tea, smoothies, you name it.
And it's clinically backed by science too. So studies have shown that buoy helps you hydrate better, 64% better, in fact. And that's data coming from key blood and urinary markers, not just marketing fluff. And honestly, you can feel the difference. I've had many clients tell me their digestion's improved, they have less headaches, and they're better energy throughout the day.
And buoy isn't just for people that go to the gym all the time and sweat a bunch. They actually offer a 35% lifetime discount for anyone that's struggling with chronic illnesses. Things like POTS, Hashimoto's, Crohn's disease, chronic migraines, and every autoimmune condition. They're really committed to making better hydration accessible to people who need it most.
I actually throw it in my coffee every morning because it's such an easy upgrade. You don't even taste it, but you're definitely gonna notice if you miss it.
If you're tired of playing hydration roulette and want something that actually supports your body, you've got to try buoy. It's honestly one of the simplest ways to feel better faster.
I mean, Becca has way more experience in this because I had an emergency C-section and then a second C-section.
Mhm.
She had and I mean, there's so much that you can do during your pregnancy, pelvic floor wise, to prepare for the baby coming through the birth canal as well. So
Yeah. No, I followed not birth was it not
birth
birth fit?
fit.
Birth fit for a while. Um and felt like those things helped obviously
Mhm.
with the delivery and,
Mhm.
recovery. I be proactive in my recovery. But I still struggled with a lot of pain and a lot of like I'm totally not going to remember the name of it, but it feels like your pelvic bone is like breaking during
Oh, yes.
pregnancy.
Like pubic symphysis
Yes. And
dysfunction.
so like
Mhm.
getting it's when like
Yes.
one leg lifts. So like getting out of a car, getting out of bed was excruciating. I had to be really
Mhm.
careful. And what I found though is that after having the baby,
Mhm.
as a female, you also it's not shameful, but like it's not the most comfortable thing to go in and have someone like reach
Yes.
their hand up your hoo
Mhm.
and like
Mhm.
transparent. That's
Mhm.
what a lot of women do,
Mhm.
but it's and
Yes.
to I tried to believe and work into my body's just going to get back to being strong in that place, and
Mhm.
if I just lift it and I do some of these at home pelvic floor therapy exercises. But the problem, even from someone that I feel has pretty good body awareness, I competed in sports all through college,
Mhm.
competed in requires a ton of body awareness.
Mhm.
I still was not doing properly.
Yeah.
And I could tell when it would get to maximum loads of
Yeah.
lifting, like I would leak and
Mhm.
I couldn't run. I
Mhm.
would leak. And so for me, it was more so as an ex-athlete, it was under fatigue
Yeah.
that it would happen. It
Mhm.
was I could be fine if I wasn't fatigued or if I wasn't under max load, but it was when like every other system couldn't support that system
Mhm.
anymore. And that's enough. You basically compensate
Yeah.
until you can't compensate.
Yes.
So it's a very needed thing, and it's sadly normalized obviously for women
Mhm.
to pregnancy and not be able to jump rope or run or whatever it might be, and every time you sneeze you pee. Like it's just it's not okay. And also what I'd love to dive into, because I think a lot of women think with the c-sections that it's not an issue. Oh no, you still had pelvic pressure on
100%. Yes.
the entire
Yes. Yes. I think that's such a
so
common misconception too is, if I didn't give birth vaginally, if I didn't push a baby out, I didn't tear, there's no harm to the pelvic floor. And I actually tell my C-section moms, like, if anything, you might need rehab more, if not, I mean, at least equally, right? Because pregnancy is in and of itself a huge load. You have this basketball growing on your belly. You have all this extra weight and pressure, and your ab muscles are stretched, your pelvic floor stretches, your whole system changes. We know your diaphragm, like your posture. And so pregnancy can create pelvic floor issues. And then postpartum, I mean, you just have, after a C-section, this major abdominal surgery, right? Like, and your core muscles have just had this huge injury. There's so much inflammation, there's scarring. The pelvic floor and the ab wall work together. So if the ab wall is out of practice and it can't do its job, pelvic floor has to compensate. So there's different problems we see typically with a vaginal birth and a C-section, but both of them I think really require healing, and that rehab can be such a powerful tool. to make sure that they get on the right track and they're not dealing with decades of issues either now or down the road.
Yeah. I'd love for you to kind of like separate the vaginal versus C-section.
Yes.
What do you see difference wise between the two in terms of dysfunction? And then how do you approach them differently, if so,
Yes.
with physical therapy?
Yeah. So vaginal birth, you're going to see a lot more like perineal scar sites. So, um, there's going to be a scar at that pelvic floor tissue, depending on the grade, how deep it goes. But there's a lot of recovery we have to do with that scar to get it to move and not be so stiff. Um, you can also experience a prolapse or, where your pelvic organs just sit a little bit lower postpartum in the vaginal canal, and that can create like pressure and heaviness. Um, you're going to have a higher likelihood of leakage vaginal birth wise, typically. Not to say that doesn't happen with a C-section, but C-sections, you're going to see a lot more pelvic pain. So, um, pain with intercourse, you're going to have a higher likelihood of like pain with the scar itself. A lot of women will say like, my scar hurts or it's numb. I can't feel it. You kind of get a shelf that occurs where there's, um, a lot of tension. And a lot of that, when we approach a C-section, a huge component of that healing is mobilizing the scar. We know it goes 7 layers deep into that peritoneum, into the ab wall, and those layers have to move on each other, or else there can be issues down the road. So I typically, there's always like such a blend, and there's never one. There's a woman who had a vaginal birth and then a C-section, or a C-section then a vaginal birth, so she could have a mix of all of those things, kind of playing a role in that pelvic
Yeah.
floor dysfunction.
Yeah. It's and the thing that I think people fail to realize is like scar tissue heals very randomly.
Yes.
It's not
Yes.
ordered. It's
Mhm.
like a big, imagine your necklace
Mhm.
when it gets all tangled up.
Yes.
That is what scar tissue feels like. And
Yes.
so if you are not proactive with that,
Mhm.
that is very compressed nerves. It can like
Yes.
it creates all kinds of issues that I think people just don't really give enough
Mhm.
warrant to,
Mhm.
and pay attention to. And then they're like, now I have this shelf, or I have
Yes.
this pain, I have this like nerve pain that's happening,
Mhm.
with ectomies, and
Mhm.
with the breast removal, they'll have arm pain because the
Yes.
scar tissue heals
Mhm.
imperfectly, and you have to be proactive. So yeah, I think the C-section piece is, people don't, you know oh, well, it didn't impact my pelvic
Yeah,
floor, but
I
Liz
had a
can speak to.
C-section. Yeah, I'm good. Yeah. Yep. And I think they
Yeah.
forget,
Well,
like, when we talk about the pelvic floor, it's kind of a system. Like the muscles, I think you mentioned it, Becca, like um it was under load or impact when all of your symptoms popped up when everything else was out of the way, right? And so it's totally a neighborhood of teamwork that happens together. You need your ab wall, you need your pelvic floor, you need your diaphragm, you need your glutes, your hips. And if those aren't in play, issues pop up. And so for a C-section, maybe your pelvic floor didn't directly have that impact and stretch through the birth canal, but your ab wall certainly did. There's incisions through all of those layers. They sewed it up. That ab wall is not functioning the way you think it is postpartum. When you go back to exercise and you think, oh, I'm just going to do my core work, it's not going to be the same sensation that you had prior unless you do that groundwork of laying the foundation, learning where that core is again, and getting some blood flow down there and moving it so it's not so stiff.
yeah. One thing I would love for you to touch on is, for me, you and I have talked, like
Hmm.
I don't have pain.
Yeah.
I was doing scar massaging and manipulation and things like that. But for individuals who are listening to this and they had a C-section
Hmm.
5, 10 years,
Yeah.
right? And they're like, I have this ledge, I have this scarring. Like
Hmm.
one of the things I have experienced, and honestly, with the use of peptides, it's
Yeah.
improved. But whatever side they sew off
Hmm.
on,
Hmm.
generally, from what I've experienced with other clients as well,
Hmm.
you have thicker tissue
Hmm.
there. So it can be like bulging and everything.
Yeah.
But you're talking about 7 layers deep. That's only imagine what we can feel on the surface. So
Yes.
what do you see in practice in terms of those individuals, like months or even
Hmm.
years later? What are some common struggles that they might not even really be associating because
Hmm.
time has passed, right?
Yes.
To the pelvic floor and the result of the C-section.
Absolutely. So, there's a really interesting association with, and I just throw this out there because I think it gets people thinking about how deep it is, but C-sections can have been linked to secondary infertility, right? So, because those incisions go through, I mean, you're incising through that uterine wall. You have to get through all those muscle layers. Then you have to sew it up. If there's restriction there, you're not getting like those effects can be seen pretty deep. So we're going to see constipation or some of that like motility issue because there's such an adhesion on those walls that need to be moving better. The most common C-section side effect that I see would be pain with sex. Absolutely. So pain with that initial penetration because everything is so restricted and tight. Low back pain is really common. I always think about like if you're taking all of that ab wall and kind of restricting it down, you kind of get stuck in this flex position, right? And your back doesn't get to move as freely as it should. So back pain, hip pain, pain with sex. Sometimes you'll get some painful bladder, like it hurts to fill up your bladder all the way, or maybe you have urgency to run to the bathroom from some of that adhesion and restriction site. And definitely, like I've mentioned, that core wall, that deficiency, where people start having a difficult time learning how to recruit their core the right way, and they compensate other ways.
Yeah, and breathing too, I think, right? Like, I
Yeah.
know that
Yes.
what the
Yes.
I did buy birth fit, it was, like, immediate following the
Yes.
C-section. She
Uh-huh.
had, like, breathing techniques and activities and things to do, like,
Yeah.
starting, honestly, within 2 weeks of that, just because we often don't think about
Yeah.
that. So
Yeah.
interesting, though, that you bring up the constipation, and I would love to just kind of talk about this here
Hmm.
in the way that I think the worst poop of a woman's life is
Oh
postpartum.
my gosh. Is that not the scariest thing?
That is the
Especially
scariest
if you're
thing.
tearing down there and you have like stitches down there. And I
Yes.
remember I don't think I pooped for like 2 or 3 days because I was so afraid to strain. I had a tummy tuck
Yeah.
last year. That is also terrifying. Because like you cannot strain at all.
Yes.
And so I was just like straight on magnesium
Hmm.
citrate through the
Hmm.
roof.
Yeah.
Anything that would come out of me. It was great.
And the squatty potty, getting your feet elevated. Yep.
Yeah.
It is
Yeah.
such a
Yeah.
vulnerable position. I think whether you have a C-section, right, and you're like trying not to push with your abs because you're essentially deficient of that core
Mhm.
support for the first few weeks until things start to heal. Or if it's a vaginal and you're like, I don't want everything to fall out of me. Like
And I didn't want to tear again because
yes.
like it was just like
Yes.
I got sewn with Carson. My first, I had to have stitches.
Uh-huh.
Taylor I didn't tear, but my first one I did. And so it was so like the witch hazel pads I lived on
Mhm.
and all of it would just be like soothing.
Mhm.
But I think also understanding how, like you said, the blood flow piece is so important because eh, and in general, and this is something I've talked to a
Mhm.
couple of our mentors about
Mhm.
around abdominal surgery.
Mhm.
So like with my surgery with a C-section, I have a
Mhm.
client about to have a total
Mhm.
hysterectomy. Abdominal surgery recovery
Mhm.
is no joke. Like,
Mhm.
no matter what
Mhm.
it is very, very hard to recover. And it affects so many things because all of your organs are right there.
Yes.
And so when you move a child out of you, or for example, you take out a, uterus or ovaries or whatever it might be,
Mhm.
your organs have to resettle.
Mhm.
Like they,
Yes.
they have to move back to places. And I think that people discount how much has to happen postpartum.
Yes.
And they're all about like, just bounce back. I'm running at 4 months postpartum and I have my
Mhm.
abs back. And it's like, no, you don't realize how much has to center itself. And I'd love for you to talk a little bit about if you can talk to
Yes.
that at all of the organs that essentially have to move. And
Yes.
one of our mentors mentioned after a total hysterectomy, they say not to exercise for 6 weeks. And he was like, no, no. He's like, at 2 weeks, start walking. Like
Yes.
1 to 2 weeks, you need to be walking, get blood flow, let things you have gravity help
Yes.
you to kind of move back to proper positions.
It is such a balance on the recovery piece, and I think this is where so many people are lost. And that's the craziest thing to me is, like we have millions of people that go through surgery a year, and we have no protocol set up. We have no standard of care. It's just like out in the wild, like fend for yourself and hope for the best. And so there's women who are like not moving for 6 months. And then there's women who are out jogging, like you said, a few days after. And I think, every case is so individual. And that's why it's challenging to say, at this point, you have to be doing this, or at this point. But typically, yes, I would say when you're having a abdominal surgery, if you're talking C-section, um, you want to be moving. You want to be managing swelling. You don't want to be overstraining yourself where you're now going to collect a lot of swelling. Now you have this inflammatory site. We're in that phase of healing where there's just so much going on already. We don't want to add to it, but get walking, get some blood flow. And then when that starts feeling better, the first stage that I think every person should start to work on is um, like start reconnecting with your body. We see this with like ACL surgeries. We see this with any orthopedic. If you have a shoulder surgery, what do? You go in and you start learning those muscles that have been affected. You learn how to re-engage those and strengthen them. Same thing if it's in your abdomen. Like your core absolutely needs to heal. It's just been impacted in a profound way, and so get that moving. Start with some gentle activation exercise. And once that feels okay, then you can progress into more challenging movements. But that should be foundational and I think mandatory for everybody.
Yeah. So we've talked a lot about obviously the scar tissue, how it can impact constipation,
Hmm.
digestion, posture, how we carry essentially like our hips and low back and all of that stuff.
Yeah.
Where do you start with clients when they come
Yes.
to you? Like, at what point are you saying, hey, it's now been 2, 4, 6 weeks?
Yes.
What are the things that we can be doing about these things actively? And with that, I would ask, like, what would you say in terms of one daily practice that you think should be a non negotiable for pelvic floor?
Breathing. I think breathing is foundational. And you can start that if you are 2 days post-op, if you are 7 years post-op, you can absolutely start to work on that. But um our diaphragm moves in coordination with our pelvic floor. And through surgeries, through pregnancy, that diaphragm can get really shoved up in the rib cage. It can get compressed. Our ribs don't move as well, and so our breathing changes, right? You'll start to notice this pattern. In fact, I had this woman in last week, and she was years past her C-section, but things started to kind of crumble around that C-section time, and then they've just escalated since. And she had no diaphragmatic excursion. And because of those surgeries, she was just sucking her stomach in. Her belly wasn't expanding, her back wasn't expanding, and as a result, her pelvic floor was just locked in place. And so the first step is learning to coordinate that pelvic floor with your diaphragm and with your breathing, learning how to mobilize that and open up a little bit more. And that looks more than just belly breathing, right? We need our ribs to move out, we need our back to expand, um, all of those things. So I work on spinal mobility and breathing, and then we'll start to work some activation drills and then progress into strengthening down the road.
Um, Yeah, I love that. I think that breathing keeps coming up time and time again
Hmm.
in terms of nervous system, managing your stress, right? Life, for example. But like you said, and I think about myself, even, I've been sharing with Becca, like my right side. I think there's multiple things going on here. But, anyways, my
Hmm.
right side is really bothering me in my back and my hip flexor.
Hmm.
I do have a curved spine at the
Hmm.
bottom. And so working practice,
Hmm.
with some of that. It really only bothers me when I've had Ethan
Hmm.
on,
Hmm.
carrier, or I'm a right-handed person.
Hmm.
So my right hip, and it's like, okay, I know I'm compensating. And it's like, okay, coming back to all of this, I'm definitely more forward.
Hmm.
My husband's telling me, right? So that shallow breathing. So I think that's a really great point that you brought up. It's not just breathing,
Yes.
it's how you're breathing. Really, I think you hit it. And maybe this is not what you meant, but this is the way that I interpreted it.
Yeah.
She's holding her stomach, right? She's
Yes.
had these
Yes.
surgeries. She's
Yes.
sucking it in. That's what she's
Yes.
always been taught to do.
Yes.
Sucking it in, you're all the
Hmm.
time. But in reality, you have such constriction, you're never fully,
Yeah.
people don't want to do that because it's like, I'm going to look pregnant. Okay,
Yeah.
well, then you're probably right.
Yeah. Well, and I think too, like you have to think of that pressure in the system, right? So as we inhale, there's a pressure increase, and that pressure has to go somewhere, right? And if you're so restricted, if your scar is really tight, if you have a lot of adhesion down low, if you're used to sucking your stomach in because you're afraid if you don't, you might leak or whatever it is. Um, that's like squeezing the bottom of the balloon, right? The pressure has to go up. So you start using muscles in your neck to elevate and breathe. And then you come away with a lot of neck pain. And that was what I was chatting with this woman about last week was as soon as you learn to move the way your body's designed to, the blocks fall into place. Those puzzle pieces go where they're supposed to. And those problems that you didn't think were connected, the neck pain, the jaw pain, they can they can release after they're not trying to compensate for you. And so I think so many women, um, you know, have they go through this big transformative experience of having a baby, and then they just get thrown right back into life, and they don't get to really put the puzzle pieces back where they need to and build that foundation. And so then they're experiencing, like you mentioned, that hip pain because maybe things they aren't
Mhm.
stacked the way they're supposed to, or maybe it's neck pain or shoulder pain, whatever it is. So
I don't know of a chiropractor that partners with a PT in terms of like pelvic floor
mhm.
therapist because I think I think
Yes,
it's needed
yes,
for everything that we're talking
yes,
about here because
yes.
my chiropractor refers people to us for functional medicine and health, which is
Mhm,
awesome.
mhm,
And it's awesome. We just talked about this in our team call yesterday. We need pelvic floor
mhm,
therapists on
mhm,
call
mhm,
because sometimes
mhm.
are the physical issues that we simply can't address. And then again, coming back to spine, a lot of
Yes.
that, those blocks be stacking
Mhm.
together. So on that, do you know a lot of partnerships with pelvic floor and chiropractors?
I do think it exists, like, especially in the birth space. I think there's a really cohesive, community where, depending like, it's so dependent on where you are, right? And I know, in my local area that we have some fabulous chiropractors who, like, we worked in tandem and they might not know what to do, so they send them one way or the other. So I think it's so specific, and I truly think this is the issue of, um, like, women's health in general is for so many of these women, like, it's not that the chiropractors that there's not that collaborative relationship. It's just that they don't know. They don't know how to screen for pelvic floor. They haven't really known what to look out for. And I think that
Mhm,
goes across all disciplines of health is, um,
mhm,
it makes sense to that one niche of what we're working in, but outside of that, other collaborative disciplines are kind of like, oh, I don't know, is this appropriate or not? So it does exist, but I think there's a lot to be done as far as education and talking about it and just bringing that awareness, because I think at this point majority of the people I work with are seeking out care on their own, right? They're noticing there's an issue, they're doing research, and then they're realizing pelvic floor is what they need to be working on. And it's not always because they've seen somebody who's been able to help them navigate that path.
right. I was just wondering because I had a conversation with somebody I met in Spain and he's a chiropractor and
Hmm.
everything comes to spine. He's like, spine
Yes.
health is the spine. And I was like, yes. And
Yes.
like, and there's also a lot of other things that you can do to support individuals, and the
Hmm.
spine isn't everything. It
100%.
matters, or so does your digestive system and
Yes.
your micro, your hormones. Like all of these things all matter together, and that's where I know for many women can feel very overwhelming because it's like,
Yes.
where do I
Yeah.
but I think you've already covered some of those signs and symptoms to
Hmm.
watch out for if you are continuously experiencing leakage, constipation. I would also say to individuals, think pre and post
Yes.
C-section.
Hmm.
What did what
Yes.
change?
Yep.
And then that's how you really know you need to be in the goods, right? In
Yes.
the lady. Um, so last question that I have is it ever too late?
Never.
For that woman who's listening right now, she had a C-section 15 years ago. I've had clients reach out to me because they've been following the red light therapy that
Yes.
I do
Yes.
and peptides. And I'm
Yes.
like, no, I don't believe it is too late. You can
Hmm.
still work on your
Never.
ways. So
Yeah.
love to hear some-
Absolutely. It is never too late. I always I mean, I've worked across the lifespan. I've worked with women in their 80s and 90s who have an active sex life, and they want to, like, have pleasure with that and not experience pain. And so things change. If you're working with a menopausal woman, there's different considerations versus if you're postpartum. And I think it's always easier to start earlier on because you don't have those habits that stack and you don't have to work as hard to rewind what your body is trained to do. But you can always mobilize a scar. You can always work on that. It's going to be tougher because that scar is going to be more fibrous. It's going to be a little stiffer than it might have been right away. But you can always come back to, okay, how is my spine moving? We can optimize that. What does my hip mobility look like? We can optimize that. Core function, pelvic floor function. It's never too late. It might just be a little bit more of a windy road the later you get started. But you can always start whenever.
Awesome.
Yeah. No, that's amazing. I think it's a very wide-reaching message in terms of, muscular health. And I think people just feel like I'm 55 years
Mm-hmm.
old. I've never lifted a weight in my life. Like, is
Mm-hmm.
it really worth it now?
Mm-hmm.
It is your body. And something that I've been really intrigued and interested in trying to improve recently is like the constant challenge cognitively too
Mm-hmm.
that exercise can provide, but also, I know it sounds silly, but like writing with your left hand and doing these things that just require that neuroplasticity, that
Sorry.
require the body to ultimately your headphone.
If you feel tired all the time and you're drinking water, you're probably missing electrolytes because you need electrolytes to get intracellularly hydrated. We love Buoy because this is an easy way to get in sodium, potassium, magnesium, and trace minerals into your day without any of the junk fillers that most powders use.
Phone died.
My headphone died. I couldn't find my one. So sorry. Can you hear me?
That's totally okay. We can hear you.
Okay. Can you hear me now?
We're good. I can hear you now.
Sorry about that, Becca.
Totally
Rewind.
No, it's totally fine. I just think, especially if you haven't exercised up until that point in life, like exercise can
Mm-hmm.
be a great way to
Mm-hmm.
keep you cognitively sharp and challenge you and
Mm-hmm.
provide like, the neuroplasticity that it can provide. And yeah, I've my dad has Parkinson's, and so I've followed even a lot of
Mm-hmm.
things around jump roping or like doing certain exercises with your hands to try to keep
Mm-hmm.
cognitive acuity
Mm-hmm.
because you lose that. Like if you don't use those things, you lose them. And so for those, even if you haven't had a C-section, even if you're well beyond, birth years, but now you're in menopause and you're noticing other things,
Yes.
um, having someone help you learn how to properly engage muscle groups is, I think, one of the most valuable lessons you can have. I'm so grateful for, my coaches and mentors over the year in weightlifting and all of those things because they just teach you how to properly move. And
Mm-hmm.
uh, it's a really important thing to have in your toolbox as you age, right? Like
Yes.
balance. And we talk about the risk of falling and hip fractures and all of these things that
And
become a very
bone
real risk.
density. Yes.
Yep.
Yeah. I think, movement is medicine. And I think what a crime it is for us. If you look at like where women, um, exercise rates, right? Like when do women quit exercising? It's postpartum. And I think that's a powerful point that we should be considering is why aren't women exercising? Why are they not jump roping? Why are they not doing impact exercise that's going to build bone density? It's going to support hormone health. It's going to support cardiovascular health. But I think there's this piece of they have their body has changed dramatically and they haven't had the tools to heal. And now they're stuck in time and they're going to age and it's never too late to work on it. But it is such a tragedy that we aren't supporting women to exercise better and to have that access because you're exactly right. Like as we age, that's the most important piece to staying healthy and longevity is movement. I think I'm
Yep.
biased, but
I, yeah. It is something I hope to be that grandma that has, biceps that are still prominent and,
yes,
you know,
yes.
super fit looking.
Yes. I had a friend and her grandma was like in her 90s every year on her birthday, she did the splits. Every day she does the splits, but on her birthday, she would do the splits and send it to all of her grandkids. And I thought, like, what a goal. Like, I want to be that person. I want to be the woman that my grandkids are like, I can't even do that, but my 92-year-old grandma has been doing this for 50 years. And that's
Yeah,
my goal.
absolutely.
That's awesome.
Absolutely.
Okay, I have one last random question, but
Yes.
I feel like it fits this conversation perfectly. How do you support clients who have had a urinary sling
Yes.
or
So,
incontinence? Like, is there anything that can be done
mhm,
post that sling you've had? And I'll back up and reframe this so that we can get a good reel out of this. And this will be separate from the podcast, but I've had a client who had the sling and
mhm.
then obviously it doesn't work all the time for individuals. So had to get another sling. And I just thought, my God, there has to be something else she could be doing from a pelvic floor
Yes,
standpoint. So let me
absolutely.
reframe this question so we can get a real urethra sling. I'm not going to say it. I'm going to say a bladder sling. I, anyways. All right. I have one more question for you. And that is, how can pelvic floor therapy help individuals who have had bladder slings recover better and maybe not have to go back for a repeat procedure?
Yes. Women who've had bladder slings, they usually are experiencing incontinence. And what pelvic floor rehab can do is go to the reason why, right? Why did they develop that incontinence in the first place? So usually it's that stress piece of, there's so much pressure bearing down on that bladder that's overcoming the pressure of the pelvic floor, right? It's kind of that teeter totter. One squeezes and the other lets go. So women should be, I think, my biased opinion is before they even consider surgery, they need to exhaust conservative measures. And I think the the current trend is if you have issues and you go to a surgeon, not always, but often you just get kind of thrown into this group of like surgery's your only option, but you aren't considering what is your pelvic floor tension. Can you fix your pelvic floor coordination and strength to begin with? Can you work on that ab wall? So that's maintaining pressure. It's like that balloon. It's controlling pressure and it's not bearing pressure down onto the bladder. Um, so I see a lot of women who I wish they had seen me prior to surgery because I often wonder if they would have needed it at the end. There's certainly a group of women who do need it, but I think it's over prescribed. I think that they're getting surgery before they've tried other options.
Yeah,
Well, I think people want a quick fix.
Yeah.
that too.
Yes.
They don't want
Yes.
they
Yeah.
don't want to do the work.
Yeah.
Like, oh my God, a massive surgery to repair a bladder. I don't know. That's
Yeah.
I would try and exhaust all possible options
Well,
before I go that
the
route.
tragedy too is that oftentimes these women, there's two different types of incontinence. I mean, there's a lot of subtypes, but there's two major different types of incontinence. And if you're going to see someone who's too rushed to really dive into your symptoms, but you tell them, "Oh, I'm peeing all the time and I want to get this fixed," and they're ready to jump into surgery, great. You did the bladder sling. You've supported that bladder. That might have not been the issue in the first place. It could have been that your bladder was really overactive, your pelvic floor was tight, you were spasming, and you needed to do different strategies. So, unfortunately, I do see women come out of surgery and it didn't fix things, right? And now they're back where they should have started. And within 6, 8 weeks, they're realizing, oh, wow, I could have fixed this and I didn't have to do this surgery and take work off and yada, yada. So,
Yeah. Do the work, guys. Unfortunately, there's no way around the work a lot of
yes.
times.
Yeah.
And it stinks as a female. I've been there. I've peed when I sneeze. I
Yep.
like I it was and honestly for me what I had to do is I had to take a break from trying to go maximal in exercise
Mm-hmm.
and really allow it to heal
Mm-hmm.
and do it because
Mm-hmm.
every time doing pelvic floor therapy and then I would
Mm-hmm.
go and max out a lift, I
Mm-hmm.
would basically regress because I was
Yeah.
like I was retraining it the wrong way every
Yes.
time, right?
Yeah.
And so I had, like in most things, you typically have to take a step back and do things that you don't want to do and take a break from things that you want to do to
Yes.
fix it so that you can go back to things you want to do, right?
Yes.
That is, I think, transferable across many uh, health aspects, not just pelvic floor, but It
It's
was definitely true for me.
it's definitely an investment. And I think for postpartum especially, it's like you get this opportunity where the slate is wiped clean. Like you can start fresh, and it's frustrating to be in this body that doesn't do what you want it to. But that means that all of those habits that were maybe not as optimal, like you can now start with a really clean slate of let's rebuild that the right way and take the time. So down the road, it's not something you have to deal with. It is frustrating though. Nothing is more frustrating than being postpartum and wanting to feel like yourself again and exercise and being like, this is not my same body.
Mhm.
Yeah.
Nope. And yeah, those little ones do all kinds of crazy things to to how
Yes.
you compensate and how, the tilts and all types of
Yes.
things. It's just,
Yep.
yeah, it's a whole big mess sometimes. But they're beautiful, amazing miracles. We love them dearly. But yeah, postpartum is no joke. We always talk about how I honestly I hate postpartum. It sucks. It's like you're tired and you like don't feel like yourself physically, and
Hmm.
just, you have this beautiful little baby that's amazing, but like it's really hard time. Especially
Yes.
those I think those first 3 to 5 months are just
Yes.
there's no routine,
Hmm.
everything's all over the place. Um, but the sooner you do these things, the easier it is to fix them.
Yes.
The longer you work, harder. So awesome. Let's tell people where they can find you in case they want to connect with you and work with you and get
Yes.
help.
Yes. I am easiest to connect on through Instagram. So I'm at Doc Kenzie Redd, and that is something that you guys can find me at. I post regularly. I post a lot about prolapse and leakage, C-sections, postpartum. And then I work virtually with women as well. So I do virtual coaching to restore their pelvic floor. So if anything that we have talked about is something that women are experiencing and they want to work from home on getting back to what they love, reach out. I would love to chat more about what I do and my programs and what that looks like.